The death of Lansing firefighter Dennis Rodman has put more attention on Michigan's mental health treatment system. Thanks for joining us tonight. I'm Sarah Swistak. The suspect, Grant Taylor, has a history of mental illness and has been hospitalized for it twice. Today, mental health experts told the legislature a law that's been on the books for more than a decade could have prevented Rodman's death. And Perrette explains.
Should the man charged with the murder of a Lansing firefighter have been allowed to drive a car?
Mental illness is an invisible illness. So if you went for a driver's license and you had poor vision, they would know not to give you a driver's license. If the person who's giving you the driver's exam doesn't know you and don't know you have a mental illness, they have no rhyme or reason to not issue that license.
Court records show Grant Taylor went almost a year without treatment for serious mental health problems before Dennis Rodman was run down earlier this month. Before that, Taylor's mother did get help from the court. He was ordered to at least 18 days of inpatient treatment. But was it enough? State lawmakers are trying to figure out how to prevent tragedies like this one. And at the heart of it all, how we get help for people like Grant Taylor. It puts a 10-year-old state law back in the spotlight. Kevin's Law gives the court power to step in on cases like Taylor's, ordering immediate outpatient care when they don't meet criteria for hospitalization.
Why don't we heed the warning signs and get people treatment as soon as we possibly can?
Ultimately, the hope is that all of those requirements are removed and that individual is able to function on their own independently.
But mental health expert Kevin Fisher says this isn't an exact science. Someone who's treated and allowed to live independently may decide they're fine and stop taking their medication. Just one example of why this will be such a difficult issue for the community to deal with. In Lansing, Ann Perrette, Fox 47 News.
Lawmakers say the mentally ill cost 3 times as much to imprison as a regular inmate. They believe corrections spending would drop dramatically if more families knew how to use Kevin's Law to get patients treated before they committed a crime.